The pinch thermometers are medical devices used to determine individual strength. Its purpose is to measure output of power in the muscles of the hand and/or forces used during contraction. Some behaviors to look out for include the patient's cheating by not keeping their elbow in and arm in 90 degrees of elbow flexion. Also, it's important to watch the wrist. Wrist should be about 30 degrees of extension and 15 degrees of ulnar deviation. Also, it's important to motivate the client to ensure that maximal effort is used.
To test tip-to-tip pinch, tripod pinch, and lateral pinch, the client should be tested in the seated position. The shoulders should be adducted and the shoulders should be in neutral rotation of 0 degrees. The elbow should be flexed to 90 degrees. Forearm should be neutral. The wrist should be between 0 to 30 degrees extension. Ulnar deviation should be between 0 to 15 degrees. The examiner should demonstrate the testing position as well as the task. Also, the examiner should demonstrate the next position of the client. Then place the strap around the wrist of the examiner and have the client hold the 0 pinch meter between the thumb and index finger. Finally, turn the knob on the reading gauge to 0. The therapist says, "Ready? Pinch as hard as you can." You will perform 3 trials with a 2 to 3 minute rest in between. Then average the 3 trials for both right and left hand.
Hey, how you doing, sir?
Hey, how you doing? My name is Eugene. I'm going to be your occupational therapist today.
Daniel.
So today we're going to be measuring tip-to-tip pinch strength. Sound good?
Yeah.
All right, and how old are you, by the way?
22.
22? All right. So what I'm going to do is I'm going to give you this piece of equipment here. All right. You're going to keep your elbow in, just like that. Forearm is neutral, so you could bend this about 30 degrees, and you can bring it down over here about 15 degrees. So I'm going to give you this here. What you're going to do is you're going to pinch with your index and your thumb as hard as you can. Okay?
Yeah.
So go ahead. Go, 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 go. All right, so I'm recording 11 pounds here that you got. Okay? So now you're going to be measuring your left arm. Okay? So do the exact same thing. Keep your shoulder in.
Like that?
Yep. Right. Go, go, go. All right, so I'm going to record you here 10 on your left. So now we're going to rest 2 to 3 minutes. I'm going to do your right again. Okay?
Yeah.
So I'm going to bring this back down to 0. All right, let's take your right arm again. All right, have you down as 11 again. All right, I'm going to bring this down to 0. Switch. Go ahead. So 11 on that time, on your left. So last time, on your right. As hard as you can. So I got you as 11. And the last time with your left, okay? Got you 10. Alright, so now what I'm going to do is I'm just going to average this in and then come up with your score, okay?
Okay.
Alright, so Danny, so what I did here is I took 3 trials for both your right and your left hand and I averaged them up to see what you scored on. And then based on the charts here, I calculated the mean and the standard deviation to see where you fall in compared to the charts. So on your right, your average was 11. On your left, your average was 10.3. So based on the chart information, you're in the 3rd standard deviation on your right side, and you're in the 3rd standard deviation on your left side. So I think you qualify for OT services.
Alright. Cool.
Alright.
Sounds good.
Thank you.
Alright.
Alright, so today we're going to be measuring the tripod pinch. Okay? So it's the same as before. Your elbow's in, arm is neutral. Okay? So I'm going to give you this device here. So what you're going to do is with your thumb and 2 fingers, you're going to squeeze as hard as you can. Okay? So go ahead, squeeze as hard as you can. Right, and I have 11 here on your right hand. And how old did you say you were again?
21.
21. Alright, so now we're going to wait 2 to 3 minutes. and I'm going to take your left arm. Okay? Go ahead. So you have 11 here. All right, so we rest again. I'm going to have your right arm. So that was a lot harder. So now you get 12 on your right. Let's go to your left. Squeeze. So that is 11. And now last time with your right. Squeeze as hard as you can. So now we have 18. And the last time on your left, we have 11. So thank you, Anna. Now I'm going to chart your score, okay?
Okay.
So Anna, based on the chart, your tripod pinch strength was measured for your right arm 13.6. On your left, it was measured 11. So based on the charts here we have in the female section, for your right arm and your left arm, you fall into the second standard deviation. Okay? And thank you.
Thank you.
For coming. Alright, so hey
Hey, how
Danny,
you doing, sir?
good to see you again.
What's going on?
So this time we're going to measure your lateral pinch.
All right.
Okay?
Yeah.
And you said how old are you again?
22.
22 years old?
Yeah.
Okay. So for this test, it's basically the same thing. Your elbow is in, forearm is neutral, elbow is 90 degrees. Okay, so what you're going to do is this time you're going to squeeze it with your thumb and your index finger just like here. Okay?
Okay, got it.
So first we're going to do your right arm. Alright, so you want to push as hard as you can, okay? Alright. So that was pretty good. I got you at 20 pounds.
It's better than last time, right?
We didn't measure this last time.
Oh, all right.
So let's do your left now. So the same with your left. You get 20. So now that we rested 2 to 3 minutes, we're going to do a second trial on your right arm. Okay? So go ahead and do the same thing. Pinch as hard as you can. There you go. Alright, so it's pretty consistent. We have 20 here. This is your left. As hard as you can, go for it. So we have 20. So again, we rest 2 to 3 minutes. This is the last time on your right, okay? So keep your elbow in. Ready? Go for it, as hard as you can. So now we have 19. And the last time with your left, okay? As hard as you can, go for it. And 20 again.
We'll use the bathroom.
Alright, and while you do that, I'm going to chart your progress, okay?
Yeah.
Thank you. Alright, so Danny, based on the scores I have, your lateral pinch on your right was averaged at 19.6, and on your left was 20. So what I did here is I took the three numbers and I averaged it up, and then I matched it with the chart over here. So based on the chart, you fall into the second standard deviation for both your left and your right. And you don't need OT services this time. So you're gonna have to go back to work.
All right. Thank you. Thank you, man.
No problem.
Appreciate it.
To prove that the assessment of the pinch grip measures is successful and valid, we have found an article called The Reliability and Validity of Grip and Pinch Strength Evaluations. So in this article, there was 27 college women participated in a study to evaluate the reliability and validity of 4 tests of hand strength: the grip, palmar pinch, key pinch, and tip pinch. Standardized positioning and instructions were followed. The results showed very high inter-rater reliability. Test-retest reliability was highest in all tests when the mean of 3 trials was used. And to highlight some of the equipment used, the best of the pinch grips was by B&L Engineering. The study was by Matejewicz, Weber, Voland, Cashman, This article also measures construct validity. Construct validity may be established by repeated administration of tests both before and after intervention. Also, a component of construct validity is factor analysis. Factor analysis is a statistical procedure for determining relationships between items.
Another article by Hazel, Kratt, and Bix proves that there is inter-rater reliability testing pinch strength with the use of a dynamometer. The article is called Inter-Rater Reliability of Students Using Hand and Pinch Dynamometers. The method consisted of organizing 73 healthy students, faculty, and staff members from a Midwestern university. Each participant completed 3 trials for both grip and pinch strength bilaterally. 2 student raters independently scored each trial. Both students were competent in being able to test for pinch strength with the use of a pinch dynamometer, and the results showed that both students had nearly similar scores on the tested participants. The inter-rater reliability of the grip and pinch strength trials was determined using an intra-class correlation coefficient, which is also called the ICC. The ICC for the jammer dynamometer ranged from 0.996 to 0.998, and the ICC of the pinch gauge in our interest ranged from 0.949 to 0.990, which is a very small sample size between error, and it proves that inter-rater reliability if the person has students are competent in performing pinch dynamometry. Another article by Theodore King II shows the lack of reliability in pinch gauge testing. So lack of reliability has been demonstrated by the study related to the reading and documentation of the results in using analog dynamometers and pinch gauges. Further inter-rater reliability studies, including demographic data of the subjects, would be helpful in developing standardized procedures.
Tips using the pinch thermometers. Some tips that we can offer include watching form, using the same device. Some companies are different than others, and that could skew validity and reliability. Try to have one person administering the test to increase intra-rater reliability. The pinch thermometer was created to have an effective tool to evaluate the hand strength or force before and after evaluation.